the Sinai Health System, because it's a system of care meeting patients' needs at every level.
The vision that we have for Sinai Health System is really transformative. It's a vision of creating the example of what an integrated health system can really be and needs to really be.
As far as a patient is concerned, bringing these sectors together is going to give us the opportunity to treat patients as a whole and to make the patient the center of the experience.
We can improve the care that we provide our patients and our communities by amalgamating and creating the kinds of system that increase the patient experience, the outcomes, and I believe the long-term improvement of the system.
Our focus is on people with complex care needs that are also in need of rehabilitative care at Mount Sinai. They're focused on very high needs patients with highly specialized care needs.
The benefit from the new Sinai Health System to the patient is the opportunity for seamless care, regardless of what stage of life and stage of living with illness they're experiencing.
The idea of bringing together two exemplar organizations, Bridgepoint Active Healthcare, Mount Sinai Hospital, to become something that's bigger than ourselves and bigger than who we are today is very exciting.
By providing a really extended continuum of care all the way from the ICU down to home allows Bridgepoint and Sinai together as an organization to take somebody who has been acutely ill for a long time in the intensive care unit, step them down to the medical unit, transfer them to rehabilitation or reactivation care, and then actually get them home using the circle of care.
Each of the organizations that's coming together is bringing some real strengths here. Mount Sinai, for example, has always been a leader in the acute care of older adults. The nice part about Bridgepoint is we can now integrate rehabilitation quicker, and our partnership with Circle of Care really allows us to make sure that these individuals can get the home and community care services they need to remain in the community after their stay at our hospital or before they even need to come here.
We know that they need an operative procedure, and that's best done here. We're now going to have the opportunity to take them very early in their course of care, get them moved to the right place where they can get rehab, get them out of bed, get them moving, and have a much better chance of getting them back to best possible health that they came in.
This partnership is going to benefit the care of patients throughout the entire system. We are paying more and more attention to the way in which mental issues and medical issues coexist in our patients.
What we'll see from the amalgamation from a research perspective is a true filling in of important gaps in the spectrum, in the pathway from discovery to optimal healthcare delivery.
So what we have now is the entire package of services for all needs, for all people across the spectrum of age and gender.
It takes tremendous audacity and courage for boards, CEOs, communities, and the government to say that the sum of the parts and working in an integrated manner is worth pursuing.
Our vision is nothing short of, transforming how we work, but also transforming how our healthcare system works right here in Ontario for people with high needs and complex care needs who use not just one kind of healthcare resource, but who use all kinds of healthcare resources.
Each of us is part of something special. We are going to make a difference.